Now coming to this year's theme. Kidneys age, just like you. Take care of them, talk to your doctor. So this is the theme for this year. So what is aging? The Americans have reduced the spelling of aging, you know that. A-G-E-I-N-G, but the American spelling is A-G-I-N-G. So the aging is shortened. So we have some WHO statistics. You find that all over the world, especially in developing countries, there is a reduction in fertility and increased longevity. Reduction in fertility, various reasons. Increased longevity, obviously medical technology and better infrastructure, availability of prevention of infections, etc. So what is going to happen, the prediction is in the next 20 years, you will have the population of elderly population doubling. So the ratio is going to change. Right now, India has the highest young generation population. This is going to drastically change in the next 20 years. 20 years later, you will find elderly population is more. So you are going to see problems of aging. Now, aging, what is aging? Aging is both chronological and biological. So if you take the human phase, the growth is there up to about 18 years. Then there is a plateau. Then you start degenerating. So aging is degeneration that sets in with time. It's not a disease, but several diseases can worsen aging or accelerate. For example, somebody has diabetes or blood pressure, the aging is going to be faster. So aging is going to be a big problem in the next 20 years. The organs age in a different way. For example, as you of course, external signs all of you see. You see wrinkling of the skin, graying of hair, baldness, so many things. But internally, the organs also age. So you find the kidneys age the earliest. So this is an issue. Then comes the lungs, the heart, and the brain. So in that organ, so important that kidneys age with time. I will just recapitulate the functions of the kidney. It may be repetitive, but still, kidneys are two bean-shaped organs which are located in the loin at the back. So you have each of the kidney weighing, it's like a fist size, a bean-shaped organ, or you can call the bean a kidney-shaped seed. So each one weighs about 150 to 200 grams, and about each contains 1 million nephrons or microfilters. So you find that 180 liters of blood is filtered every day, out of which only 1.5 liters comes out as urine. So 178.5 is reabsorbed nearly. So the urine that comes down from the kidneys comes through a ureter. This was what I was mentioning, that in people with cancer of the uterus, the ureters used to get blocked. So you have the ureters coming down, bringing down to the reservoir called the bladder. So once the bladder accumulates the urine, it reaches about 300 ml or so, you get a signal that is sent to the brain that you have to pass urine, that the bladder is full, and if social conditions are good, the brain signals back to the bladder saying that yes, you can pass urine, the sphincter is open and the urine is passed. So this is the nephron or the microfilter inside. Now the important point here is that with aging, you find changes in all these entire kidneys and the urinary tract. I am not going to talk much on the urinary tract. You will find that with elderly people, there is a prostate gland which is located here. So which starts enlarging. It is below the bladder. It starts obstructing the flow of urine, and it makes elderly people get up more often in the night to pass urine. Same way in the women, the urethra or the external urinary passage, because of menopause, narrows down. So you will find that it becomes difficult sometimes to pass urine, or sometimes they have leak or incontinence. That when they laugh, or it could be socially very embarrassing, that they can't control the bladder. So these are issues which are related to age, which I am not going to talk to, because I am going to talk mainly about the aging in kidneys. So what happens to the kidneys with age? So the weight comes down. In 20 years, by between 40 to 60 years, 70 years, you find that the weight drops by 25%. The kidney, which is about 150 grams, comes to about 125 grams. It shrinks. So you can have, if you do an ultrasound, this is the normal ultrasound. How we image the kidney? We do an ultrasound. Nowadays, ultrasounds are available everywhere. So we can visualize the kidney. This is the normal kidney. So you will find with elderly kidney, the kidney starts shrinking. It becomes small. And you do have certain cysts which get formed in the kidneys. So cyst, a lot of patients get worried excessively that cyst means maybe a malignant condition. They come running to the doctor. Doctor, the ultrasound has been done. I have a cyst. There is a problem in my kidney. No, cyst is a benign condition. Often it's a marker of aging. That it just shows that the kidney is getting aging and clear fluid-filled spaces are seen in the kidney called cysts. So you find the structure, reduction in the weight, formation of cysts. Microscopically, the nephron that you see, this gets scarred. So it is not that all the nephrons start working less, but instead of having 1 million nephron, it now comes to, it drops by 40%. So rest of 40% of the nephron die. So every year the nephron goes on dying. 1% of the nephrons die every year. So every decade 10% of the nephrons die. That's why your kidney function comes down. So this is called reduction in the glomerular filtration rate. We estimate the kidney function is called the filtration rate. In ordinary terms, GFR. It's called glomerular, what is mean a nephron, filtration rate or GFR. Now the filtration rate normally in an adult is about 80 to 90 mLs per minute. That's the way you filter per minute. So much of ml. Now this starts reducing with every age. So when you have a coexisting disease like diabetes or blood pressure, the aging becomes faster. So the estimate is that if kidney failure or kidney insufficiency above the age of 60 years is 10%. So 10% of the population have kidney insufficiency. It's a big problem all over the world. In the Western country now, if you enter a dialysis unit, you will find that about 25 to 30% of the patients are above 60. So the elderly people are on dialysis. So you find with aging the kidney function going down. So how do we estimate the kidney function? The simplest test, I am sure some of you would know, is serum creatinine. Now the serum creatinine is a substance which is produced in the muscles in the body. And this is removed by the kidneys. So if the kidneys don't work, the creatinine accumulates in the blood. So we estimate the creatinine. Urea is another substance, but it has problems, so we don't talk about urea. So creatinine is a marker of kidney function. So if we do a blood creatinine level, we will know what is the person's kidney function. But then with age, there is a problem with this. With age, the body doesn't produce sufficient creatinine because creatinine is produced in the muscles. So you will find that somebody with an elderly person will have a normal creatinine, still the kidney function is low. So that's why we have evolved what are called eGFR, electronic GFR. The filtration rate is made electronically by using formula. Don't get scared with this formula. I think Vasu is not here. Vasu always tells me that in medical talks you should not have complicated issues. So this is not for you to remember at all. For that matter of fact, even I don't remember. It's only the unfortunate, the nephrology fellowship candidate who has to remember. We just look at the computer, we type the person's age and weight and creatinine and we get the result. That's all. So it's very easy. What I'm trying to say is that the formula takes into account the age and weight. So if you have, I'll give you an example. It's very easy to understand. There is a 30-year-old man. His serum creatinine is 1. So his filtration rate or GFR is going to be 80%, 80 mLs per minute. Now the same 80-year-old man, if he has the serum creatinine of 1, same weight, his GFR is only 40 mLs per minute. So his filtration rate has dropped drastically, but the creatinine has not gone up because the body is not producing creatinine. So this is how elderly people often get misled, even doctors. They look at the reports, they say, oh, the serum creatinine is within normal value, so this person does not have a kidney insufficiency. No, it's not so. So with age, your kidney function does go down. The importance of this is not for day-to-day, it's not for any issues like landing up on dialysis or kidney transplant, etc. What is important for this is that you should know that elderly people have reduced kidney function, so the drug dosage has to be reduced. Various drugs that you take, antibiotics, painkillers, day-to-day what you take, the dosage of drug has to come down with age. It's an important point for both doctors and lay people to realize. I just said the excretion of salt. The normal salt intake in the Indian diet is about 10 to 15 grams. The World Health, WHO's recommendation is only less than 5 grams even for normal people. So we are already overshooting the salt intake, and with elderly people, with age, the ability of the kidney to excrete sodium is lost. So you find that they retain salt more That's why the blood pressure also tends to go up. So it's essential that as you age, you should bring down your salt intake. Especially you should not add any extra salt to your food, and make sure that you make a comment, oh, the salt is less today in the food. So it should be like that, the cooking, that the salt should be less. The recommendation should be less than 5 grams. Water handling. A very important point in the kidney is that it can handle any amount of water. Somebody drinks half a liter, somebody drinks 10 liters, still the kidney can get rid of it. This is the normal kidney. So this is called the concentrating and the diluting capacity of the kidney. So concentration means if I stop your water intake, you go on fasting, you hardly pass urine. You are able to concentrate the urine. Whereas if you take a lot of water, you dilute the urine. Now with age, what gets affected is the concentrating capacity more. So you find that an elderly person cannot concentrate urine more. So elderly person actually requires extra water. So the normal person as he ages has to increase his water intake. If you find at birth your water content in the body is 80%. After the age of 70 years, your water content is only 60%. The body shrivels. This can be seen all over the body. The skin becomes dry. The weight muscles become again softer. So you find changes all over the body. So the kidney cannot concentrate the urine. So you got to give an extra glass of water to the elderly. The only problem that I see in our condition is that the lack of public restrooms all over the country. So proper restrooms is a huge problem. So it becomes very difficult. People try to avoid water just because there are no proper restrooms. So unless this condition changes, that restrooms are easily available, this is going to be an issue. It's a very important issue that in the country as a whole, as a public health issue, we should have restroom facilities all over. Potassium excretion. Potassium, as you know, is present in fruits, juices. The highest source of potassium is orange juice and coconut water. See, with age, the kidney loses its ability to again prevent potassium loss. So, elderly people require more potassium. So, you require to take more fruits and juices so that your potassium level is better. Like sodium and potassium often go opposite. So, you got to lower your sodium, you got to increase your potassium. See, there are a drug called diuretic, which is often used. In elderly people, it removes a lot of potassium. They can get into trouble. So that's why when this drug is prescribed, diuretic is a substance which is used to increase urinary sodium so that you pass more water and salt so that your blood pressure comes down. If you have swelling, somebody will prescribe a diuretic. But when you take a diuretic, you can get into low potassium. So it's important to know. And what are the side effects of low potassium? Generalized weakness. You can't identify. The person feels he is exhausted, he is weak. He goes on wondering, he tries to take vitamins, pills, this injection, that injection, not realizing that his potassium is low. So as you age, you got to take care of your potassium intake. So what are the messages for today? Kidneys do age. Remember that. Whatever your kidney function shows, still with age, your kidney function goes down. So very important that you adjust the dosage of various drugs. Reduce your salt intake. Please increase your water intake. Take sufficient potassium intake. And so be careful of the tests for the kidney function. Tomorrow is the World Kidney Day. This is the poster from the World Kidney Day talk. It says, please start the day tomorrow with a glass of water.